Strap in, folks. We're kicking the DeLorean into gear here, clocking 80 miles an hour on our healthcare journey. And the result? We've saved $3.6 million in making change to self-insured, landing our plan in the top 5% of health plans in America and a Rosie Award winner. Now join me as we unlock the Flux Capacitor in your Employer-Centric solutions and benefits plan. And we're going to take this into a time-traveling success story. You've heard about going back in time, and we're going to examine really what that looks like in action. I'm going to present a case study, and I'm going to discuss how putting healthcare into your health plan can have success. First of all, I want to thank Dr. Keith Smith and Jay for letting me speak here today. As Todd said, I kind of have a unique perspective. I've been a provider, frontline, for 38 years as a physical therapist. I've seen what the changes in healthcare have done to my patients, to my reimbursement, and most importantly, really to my relationships within the medical community as large PE entities have come in, large health systems have taken effect and taken over things. Two, I have a 27 clinic outpatient physical therapy operation in Arizona and Texas with 550 employees. I'm the buyer for our health plan. And as the buyer for our health plan, I'd seen those rates continue to increase and felt the effects that they've had on our system. And third, I'm a solution. I am the CEO of Solve Global, which is a direct-to-employer solution for primary care MSK spend. So, with those three things, I'm going to ask you to challenge the status quo in your thinking, in your planning, and ultimately in your actions. Everybody's in the health insurance business if you have employees. That was a realization for me at a certain point in time. And the more employees you have, the greater your risk. You may know your business, but do you really trust the healthcare industry with your checkbook? If you're self-insured and you don't have a strategy or plan, that's exactly what you're doing. You're taking the risk and saying, yeah, they'll take good care of it. If you're fully insured, well, again, let's just say the insurance companies love you and you're going to get your premium increases and never have the actionable data from which to make a decision. So, either way, you're kind of having some challenges there. My responsibility as the CEO and as a buyer of our health plan was to understand the system and examine the solutions. And that's exactly what I've been doing for, I'd say, the last 7-8 years. And as I began to educate myself and becoming more knowledgeable on that, I also need to educate my employees in helping them become better medical consumers. And how do I ensure the quadruple aim for them? Very important for me. And this was difficult for me, and I'm in the healthcare industry. How difficult is for the other employers out there who have difficulty understanding this ecosystem? I can't imagine. I help a lot of people navigate through this system on a regular basis. And for those people who are not familiar with healthcare, it's challenging. But not only do you need a strategy, you also need a system and you need a trusted medical provider. The system can deliver care in a positive way and reduce your time, your risk, and the expense of it all. So I need to understand what problems do I need to overcome. Here was my situation. This is what kind of crux of it all. At a growing company, I'd been in business for almost 25 years. We were busy, but my health plan was out of control. And it was threatening to bankrupt me. And as a provider, I'd seen my payments go down by up to 25% between reimbursement cuts and increased regulatory pressures. Everything that's being said here today. As a buyer for our plan, I've been getting that 7 to 12% increase on an annual basis with diminishing benefits. And so now my benefit plan and my ability to keep people in that was decreasing. They were getting crap. This is the best way to say it. But that's not the worst part. Across the street, the hospital system could charge 2.5 to 3 times what I could in outpatient for the same services and get reimbursed for it. and we're competing for staff. So obviously they could offer a little bit more, and so this was a critical area for me, and I got to have a winning strategy in order to stay on top of that. So the three main obstacles that I need to have, just obviously rising costs, both in workman's comp as an employer and in group health are rising annually. Gotta have a plan for that. And we know that there's a lot of waste in this $5 trillion industry. What are you going to do with that? 2, non-alignment, non-transparency, whatever you want to call it. Nothing else is purchased the way we do healthcare in America, and that's been said many times, let alone trying to navigate the system. And 3rd, as it's been said very many times here as well, health insurance does not equal healthcare. We've been brainwashed for over 30 years that you need health insurance, and most people equate that with healthcare. I've never seen that little card do surgery. I've never seen that little card do make a diagnosis. Healthcare takes place between a provider and a patient. To me, that's a sacred interface. And everything on that card is a barrier to people getting basic primary care needs. The deductible, the copay, visit limits, authorization, they only add to the overhead and administrative burden. Now, I'm going to talk a little bit later on some of the things we did for 1 and 2, but I want to dig into number 3 just a little bit more. So I borrowed this equation and rearranged it from Darren Fogarty, and other people have used this as well. My overall goal was to provide optimal health care while lowering my total overall costs. Pretty simple. But these layers create a lot of barriers. And on the flip side, they create a lot of opportunities. So I'm stuck in this system, and each one of these things creates ripe opportunities to accomplish my goal, but not if I stay with the book of care. I have to do something. And I have to create aligned incentives on each one of these. And there's lots of solutions out here that tackle the admin, the TPA, mission side of things. Take advantage of them. They're awesome. And but also realize that until you start tackling claims, number 1 up there, you're still not going to be addressing your biggest risk. So let's look at that another way. So I'm just rearranging the chips, and when I move from fully insured to self-insured, you get control of some of your fixed expenses. And even if you move to a captive, you're going to have 15 to 40% of your fixed costs, be in that category. Great, you nailed it. There's lots of opportunity there. Biggest number, still 60%. Claims. Pain drives claims. What are you doing to decrease claims overall? And better question to ask maybe how do I move from today's sick care system to a healthcare system? Have you really examined what's in that claim bucket to really understand how to tackle it? I did. I looked at every claim, every line item for a year and a half to see where my people were going and what we were doing. It's a lot of late nights, a lot of exhaustive studies, and a lot of embarrassment as well, right, to be honest with you. So in my world with limited resources and time, I need to utilize a system that says, how can I have the greatest impact on that, the greatest impact on my people, and deliver my greatest ROI? We've heard this before. Just quick public service announcement on that. No business survives on 73 cents overhead. It's just crazy. So reallocating that and bringing that back into my company was part of what I wanted to do in delivering not only optimal healthcare, but reinvesting that. So that about that. Back to tackling claims. We know that 80 to 85% of medical issues and lifestyle issues and musculoskeletal issues can be resolved with primary care if you enter that first. And, so if you're an employee like me, you got to choose, like, how do I get into this game? Which one do I start with? So I'm going to show you what I did. The first thing you got to do is you got to look at the data. Look at the numbers, they don't lie, and understand what to do with that. So, what's the number one cost in in both workman's comp and in group health? What's the number one cost, or one leading driver of chronic pain? What's the leading leading cause of disability? And what's the leading driver of opioids? If you have some musculoskeletal on the pole, you would be correct. Now, a lot of people answer cancer. Cancer gets a lot of attention, doesn't it? But on a percentage basis of people affected with cancer, you get your shock claim there, but it's very minimal. These are nickel and diming in all day long, every day, at 50 grand a piece. And you have 10 of these, and you got one shock claim. So, it's a matter of looking at this and understanding that and saying, musculoskeletal affects over 50% of my employee population every month. And we're a relatively young, healthy company. There are some companies that ranges up to 60 to 70%. The problem is, next month, it's a different 50%, but the number doesn't change. So how are you going to get into moving from a reactive system into a proactive system? We've heard about some of the great reactive solutions we have out of that save money. But what if you prevent the claims from happening, from the beginning? So my first thing was to institute a solution that I'll talk about in just a minute. This is another slide that says everything. Got your money on one axis, your time on the other axis, and you got some lines up there. Red line is indicative of where healthcare costs are going. Put your angle on it, whatever you want. It's just going, right? It keeps going up on that. We've got 50 years of history of that happening, and it continues to happen. And I don't think the status quo is going to bend that line at all. The dotted line is your informed decision point. When you make a decision, say, I'm gonna make a change and put something in my health plan. The green line is what happens to your claims and your cost after you make that decision.
Right.
The longer it goes, the greater the disparity is between those two lines. And that's the opportunity to reinvest. That's you call it a lot of different things, but that's money that is wasted out of your system. If you're an employer like me, that money's gone. Dave was just talking about that being taken out of a community. It's exactly what it looks like. And I don't have that ability now to pay my employees more, to offer better benefits, or to give them wage increases or anything like that. So you got to make a decision. The longer you have that decision go, the more opportunity you're going to be losing. So it's hard for me to understand as an employer. I mean, I just literally, the reason I put that first pull out there where you hit somebody over the 2x4 is I've been very tempted to do that to a lot of employers as I'm talking. They're like, it's right here, it works. And I'll show what works, but it's amazing that more people just don't take and say, what do I need to do to take this step and make it happen? So how did I tackle those three problems that I just mentioned? I want better healthcare. I want a better take home for my employees, take home income, and I wanted to reinvest that waste in the healthcare system. Status quo is always an option, as we said. It's an expensive one, but it's not one I was willing to take. And people ask, why do you do it? The answer is pretty simple. My people are worth it. My business is worth it. And how far outweighs the effort you put into it. It's crazy, to say that this thing that's been going on for 30, 40 years is all of a sudden going to magically turn around. But it's not unless people make decisions and take action. So Problem solution dividends, I want to blow through these fairly quick, but you're going to understand a little bit about what we did with our plans and go with that. I didn't have any control, I didn't have any data as in a fully insured plan. Jump to an unbundled self-insured, not recommended for the faint of heart. I did it all at once, okay? Why jump in without a parachute when you can walk up and do stuff really slow? But the dividends, that first year I did it, every one of my employees got a $1,200 raise in the form of a premium reduction. Our premiums are still less than $100 and our deductibles at $500 to this day. And we've had zero increase over the last 4 years. I've got an MSK risk. I've got to put in a solution. I put in a solution called Solve Global. Solve Global is a proactive, tech-enabled solution that finds and fixes your MSK risk, and it keeps it from becoming a claim. It works across both sides of the aisle, both the workman's comp and group health, and that was a big thing for me. Primarily because people don't look at this, but physical therapists are manual laborers. We grab limbs and bend things and do things for a living. And my people need to be at their optimal health in order to deliver our business. So if we're going to deliver that business, they've got to feel good. Plus, they're generally real active people, so they're going to go out and do a tough mudder on the weekend. So it was really important for me to take care of them. And so we got injury prevention. It gave us a lot of trust with our employees that they said, you're putting in something that takes care of that. What I also learned about my employees is that they didn't have access to primary care. They've been bought. All the primary care have been bought and gone into large entities. And then the access points and the other things that they were, the barriers of these systems from the time, et cetera, that's been talked about ad nauseum, create an issue. I was fortunate enough to meet Dr. Johnson. He explained to me what DPC was. I became an instant believer, and so we put in direct primary care. And our people have 24/7 access to a physician. They get their imaging labs, all of that taken care of, and for no cost to them. So between these two, I've got your primary care medical, your primary care MSK covered. And for that, for zero cost to the employee, that was a tremendous boon for us. And we just kept a lid on our claims. And when you keep a lid on your claims, a lot of other things can happen. So I talked about that recruiting retention thing that I was having an issue with. Well, I took the savings off the health plan and I put it into a loan repayment program. And I just talked with the med students just a minute ago. They were talking about coming out of school with debt. PTs are no different, a little less maybe, but it's still a significant thing. And this is a huge take-home win for them. It's pre-tax to them, so it just increases their take-home income. So we spend $30,000 a month on that. So it's this huge thing for us as our company. So what's that look like? What our plan looks like. So the green is a reinvestment. When we work proactively and we pay things in advance, we call that a reinvestment because we're doing that at no cost to the employee. So our DPC, our Solve Global, our reinvestment back into the loan repayment, all of that is is a big thing for us. And we didn't look at our total spend, but almost half of that, not half of it, but a good 45% of that is a reinvestment. So you can kind of do a little math there and see what our claims are like. And most of the, if there's any advisors in here, they've already done the math on that and go, man, that PEPM is pretty low. It is $294. So, but healthcare in your health plan kind of works. Take care of the things before they come claims, kind of works. Taking care of my people, it's a part of my business. So, here's my offer to you. We've done the homework. We've taken the time to test a bunch of the systems. Todd, unfortunately, is getting, we're testing systems all the time, so he's like, what's that? But it's all about getting better. It's about what is the next step for our outline. We put in regenerative Regenix or biologic this year, and in a solution for the diabetes as well. I'm kind of anxious to see, man, what's that going to impact on things? Because we do have some people in that population. We have, some medications and some issues on the PPO. We're working with a new vendor that's helping us on that end. So we're excited to see what the next step of this looks like. But it's kind of funny when I get a question like, when are we going back to Blue Cross Blue Shield? And I'm like, wow, you come around to this side of the podium and look at what I see it and tell me that. But it just tells me there's someone I need to educate in the system. So, we've done that. We've tested these things. If you feel the same way and want to save time, and I'd love to talk to you and understand, a little bit more about what this looks like with your clients or in your company, or as a provider, how may you get involved. Thank you. Let's use the mic.
We have a few minutes for questions.
I posted this on your page in WOBA. I always say WOBA, sorry. What is the biggest obstacles that you encounter by being self-funded though?
Biggest obstacle in being self-funded?
Or obstacles, yes, in being self-funded.
I don't think there's an obstacle. You just have to understand what the system is. It's not that complicated. Okay? They want to make it complicated. Break this. Usually how Tim gets things done. He breaks something and then we fix it.
Yep.
It's not that complicated, if you start with healthcare. So the biggest issue is understanding, what do I need for a PPO? What do I need for a TPA? What do I need for a network / network basis? And where's my stop loss? I understand those things. Once I understand those, several of those are commodities. Find the vendor that works with you and can work with what you want to put in. But it starts with what my goal was, which is I want to decrease my overall costs and give better healthcare to my employees. So they got free access to healthcare. They didn't have that. And it's awesome healthcare, by the way.
My part two question is, how important to you is it to really educate your employees to be empowered and which enables them to have those conversations with these providers, to ask the questions that we've always been taught not to do. You go in, you pay your copay, you do what the doctor says, and that's it. And we're having to change that mindset. So how important is that to you, and has it been successful?
The trust of my employees have given me to do that is tremendous. So they've allowed me to stumble and fall and make some mistakes, but they believe in where we're going. So one of the other aspects of this that was great, I don't know if I said this out loud, but last year was we were able to tell United Healthcare to take a hike.
Woo!
Okay. That was 14% of my business, 10% of my revenue. You got to have buy-in from your team, because we're, like I said, we're not a small company, tens of millions of dollars. So you do the math pretty quick and go, ooh. And I'm like, yeah. I can tell you that we signed up for DPC in June of 2020. That's a stroke of a check that I didn't really have the cojones to back up, but thankfully he thought I could.
I had no worries about it.
But the reality is, in June of 2020, things weren't back, right? we don't know if we're going to survive as a company. I just laid off 180 people. And we're on the comeback trail, but I'm going, if we're on the comeback trail and I believe in what we're going to do, then we need healthcare. We need to put it in. So that was a stroke of a check that, paid huge dividends down the road. That was a leap of faith there, at a risk standpoint.
What were the keys to your success for helping your employees manage through the change of where they were to where you wanted to get to?
A big part of it's our culture to just start with. We have we're totally open book, right? My employees know what I make. They have since day one. everyone that runs a clinic, they have their own books, they know what we do. So that open transparency is just part of our language. And they don't like filling up these flipping forms from Optum or United Healthcare anymore, and anyone else is like, that's not what they went to school to do. They want to treat patients. They want to do great work. So that's just noise to them, and it's useless noise. So it was easy to get them on board. Now, I will tell you that reaching the spouse and reaching the other members of the family sometimes can be challenging. And so this year, everybody's invited to the meetings now, not just open enrollment for employees. This is open enrollment for anybody on the plan that's an adult.
My question would be a little too detailed, but our organization, about 6 years into being self-insured, and we've seen all those great savings. My question is around stop loss. In 1 year, with one laser on one employee, my cost went up 25% in 1 year because of one employee. I don't know, you get a difference.
Josh, it's a commodity.
Well, that's my question. If you see anything with
Yeah.
stop loss that's been a concern.
Yeah, you know what? If you throw 3 or 4 of them, they'll fire you. So fire them first. I mean, literally, it's a commodity, and there's advisors here that would take you down that road. I think we switch every other year. I don't know. I mean, it's. I'm not married to them. I can tell you that. Our next thing with data, though, is to take the data and say, look at our consistency on claims here. Lower that. That's my next biggest number that I want to hammer. So I'm developing a reserve to kind of offset that. So I'm kind of, and it's my next thing in the sights here. Data. You gotta have data.
Gotta use the mic. I got chewed out earlier session for not using the mic. We can't have it.
I'm just gonna say that for stop loss, it's all about data. It's like you just gotta have good data, prove it to them. If they're not buying, move on. Somebody else, there's probably 20 stop loss carriers here that would tell you the same thing. Because somebody's gonna be interested and say, I believe in what you're doing. I may not know exactly what declaration I should give you, DVC or the ZSK solution, but you know what? Like, I believe it. Let's do this thing together. And then next year you will have the data, and you hope you win again, and you don't have to change. But
I've got a shock claim every year. I got 1 to 2. People get cancer. People, those things happen. Or you got young, healthy PT companies. We have babies. If every once in a while one of those ends up staying in the hospital a little bit, and that's fine. Because we're taking care of 80-85% of the stuff. We can focus on that and make sure they get the right care. And there's still some things we're smoothing out on that end, but when you're not distracted by noise all the time, it's really fun to focus on, getting that healthcare there. You mentioned data, and it is really key. In our Solve Global solution, that's exactly what we do. We collect data every month from every employee, and it goes through a predictive analytics program. So if I'm going into a company, I'll just say my company, therefore going into our company, you have the ability to say, what kind of problems you're having and how much it's bothering you, work or home. Doesn't really matter to us because it's an employee. We do that same thing with large employers. 1,000 people. I'm walking in as one person. I don't know who to see. Data let you do that, and it's proactive. I'm not waiting for the reactive system so that I can go save money on a surgical bond. I'm trying to prevent the surgery from happening, which doesn't make popular with surgeons, but eventually they'll get to the surgeon if they need it.
Sorry, I probably wasn't clear.
Yeah.
Our stop loss coverage went 25%. My total healthcare costs went up 25% because of one employee. Because of the laser they put on one employee. Now, I raised the stop loss. With the plan, it went up 25% in 1 year.
You're self-insured?
Yeah.
That's a choice.
Yeah. Well, my question was, how do you view the stop loss? Not the cost of the stop loss.
The stop loss is a fixed expense for me. It's just locked in there. I'm watching that variable claims. I'm really trying, because that person who's going through that involved medical condition is having, are they getting the right care, and in that. And again, if I only have one or two of those, and that again, in a size company of ours, 400 people on the plant, we can stomach that. Now, if I've got 15 of them, then you gotta ask some different questions. But I would say that when you have a proactive BPC involved, and on our side, proactive MSK involvement, it works. At least it does for us.
One last question.
So I just wanted to make a comment, and then I have one last question for you. The comment is that this whole conference is about free market solutions, and none of the people here would be here if it weren't for a few brave employers who feel like it is important enough to take good care of their people for them to do something different than all of the other employers that they know. There's not one person in our town that Tim Spooner could have looked to and said, I'm going to do what that guy did. He had to go out totally on his own and figure out how to do something different and better for his employees. So I don't know if you guys would mind giving a round of applause for that. And my question to you,
The picture of me running naked in the wind is just not one you want to do.
and my question to you is, how did you do it?
I think that, again, the first step for me was understand. I had to understand what healthcare was, and understand. I always thought that there was a payer out there, and that was Blue Cross Blue Shield. And I met with every one of them, trying to get increases, trying to negotiate better rates, trying to bring them solutions. And I've got the national director of Cigna sitting in front of there and say, why do we care? I've got, our rep for United saying, you have to fire us if you want to negotiate with us. I've got Blue Cross Blue Shield saying the treatments you're doing on public health, the same study we brought to them, they were using to say that those were experimental. We're like, this shows that it's factual. It was Marty McCary's, Dr. McCary's speech all over again. I've lived all of those situations. And so once I started to understand, well, they want the payer and I need to go to employers, what are employers doing? Then I started to understand what is in my healthcare, my health insurance. And from there was, I borrowed in back of Dave Chase's book, there's an appendix there to see what your broker's making. And I shoved that across the table at him. And his partner called my HR person, and the CEO called me and said, we do something wrong. And it's just those light bulb moments that dawned on me. They go, well, they're on the tape. Of course they're not working for me. So I had to flip that script, get an advisor that worked for me, and put that plan in place. And, again, if you think you're going to have everything figured out and solved, forget about it. This is complex. Healthcare and people are complex, but trust yourself that if you get the right trusted medical providers around you, that you can make those decisions. That's key, because if you're just going to trust the system to do it, you're hosed. And so making sure that, we started making those steps. And once I started making the steps, my first year out, I had 4 cancers, folks. It was not pretty. So I got hammered. Everyone says it's like 1 every 4 years or 5 years. I don't know what the statistics are on self-insured. Mine was right out of the gate. So here you go. Here's your bat to the nose. You want to do this some more? I go, yeah, I did. This is glutton for punishment, I guess, because I felt it was worth it.
Good.
Appreciate it.